Hello, everybody. Welcome once again to the Wednesday night webinar, our always fun and exciting time that we like to have here at NOCD. And we have a guest tonight. Hi, Aneela. How are you?
It's nice to meet you again. And
Again, yes.
for everyone who's joining tonight.
We have Aneela from HabitAware. HabitAware tonight. I say it too fast. And why don't you tell everybody a little bit about you and your story first and why you're here. And tonight we'll be, of course, going over all of our Q&As. We'll do some OCD stuff, but we are definitely going to be focusing a bit tonight on body-focused repetitive behaviors. We've had questions that have come in the past about skin picking or hair pulling, and so we're going to try to devote the bulk of tonight to those questions. And Aneela from HabitAware is here tonight to talk to us. So hand the floor over to you first.
Oh, awesome. I appreciate you so much for having me. BFRBs and OCD are medically related, right? In the DSM-5, they are categorized as related disorders, related conditions. And I am coming to you here today with lived experience with trichotillomania, which is compulsive hair pulling. And I like to say I have an alphabet soup of mental health conditions. So I have BFRB. I have, I do think that at one point in my life, I definitely had anxiety and depression, and OCD intrusive thoughts. The more that I understood what OCD intrusive thoughts were, I was like, oh, that is something that I've also dealt with. And so it's really interesting how when one is there, it's sort of like an iceberg where you can see the one that's like the biggest of the problem of your life. And then when you start sort of chipping away, you see that iceberg of like, oh, there's a lot of stuff going on here. So my lived experience with trichotillomania, I started hair pulling in my tweens, and I hid it for nearly 25 years because I thought I was alone, I was weird, I was wrong for doing this thing to myself. And I thought it was my fault because it was my hands reaching up to my eyebrows and my eyelashes and pulling them out. Like I was choosing to do this, which is now I understand not the case, right? It's not, they even say it's a disorder, not a decision. And a couple of years ago, my husband caught me without eyebrows. I had a really bad pull session the night before. I got up in the morning, I looked in the mirror and I went, whoa, and I ran to the bathroom to get my black eye pencil, which is how I really managed to hide it from everybody for 20 plus years. But he was coming out of the bathroom and he bumped into me and said, Aneela, where are your eyebrows? And so 2013, I shared my secret.
Dun, dun, dun.
Oh my God, I was like deer in headlights. Like I think I froze for, it felt like minutes. I didn't know what to say to him. And finally I just told him the truth because my brain was like too slow to come up with a lie, like what lie is there even? And that was it. Like that was the moment where I was so afraid that he would say, that's gross, we're done. It was just 2 years into our marriage. But he took to the internet. He was very curious, that loving curiosity of what was this? Why didn't I share with him? And he understood the shame that I was sitting with. And then one day we're sitting on the couch and we're watching TV and I'm pulling and he gently grabbed my hand. And that was this aha moment of, I wish I just had something that notified me. And that is HabitAware. That's the work that we do, where we've invented a smart bracelet that detects when the behavior is happening, and then it sends this vibration to bring the behavior into the consciousness so that now it is a choice. Now I can say, well, I'm going to pull that one and then I'm going to stop and I'm going to take care of myself, or I'm going to do it right away. Take care of myself. Yep.
So it's a vibration. It is not a 3,000 volt shock you are telling us. No. Okay. All right.
And a lot of people do ask or do say.
I know. That's why I'm saying it. Yeah.
And to those people, I want you to know that if there is something in your life that really, really is terrible, fighting it is not the answer.
Right.
Shock is not the answer.
Right.
You need to meet it with love for it to release its hold on you.
Yeah.
And so we like to say that the vibration is a hug on the wrist, that
Mhm.
when you see it with that like tenderness, with that like, oh, it's my gentle reminder, it's my buddy, it makes that journey of using awareness and training yourself to change your behavior much more positive and healthy and rewarding.
Mhm. And not only are you the inventor, you're a client, as they say.
Mhm. Yeah.
Yeah, that's awesome. Uh, we say similar things with OCD. We talk to people about if you try to fight OCD, you lose,
Mhm.
right? I
I've
I
tried to fight those intrusive thoughts, yeah.
Yeah,
Yeah.
I love showing the ending of the movie of It to some of my members that I work with, where the adults are fighting it and they're getting their butts handed to them, and then Mike says, "There's there's one way to there's more ways one way to win, and that's to convince someone that they're small." And
Mhm.
once he says that, it can't harm him anymore.
Mhm.
And then all of them just convince it that it's small until it turns into this little baby and they rip its heart out and they shred it, right? And everything like that.
Yep.
It's really awesome. But that is the key. So I love that you feel the same way because
That
I feel the same way about OCD work.
Yeah, I mean, every challenge, like, 2 years ago, 2022, I was diagnosed with breast cancer, and that's honestly the work that it took me to overcome my hair pulling.
Yeah,
It transcends, like, this it's the same lesson. We're gonna get the same experience over and over until we
yeah,
learn this lesson that whatever the challenge is, if we meet it with loving curiosity. I looked at my breast cancer and I said, "What are you here for? Why are
hmm,
you doing this to me?
hmm,
And why are you doing this for me?"
hmm,
And I just kept saying, "I want this done as quickly as possible. I'm gonna do whatever it takes." And I danced with it and I laughed with it. I cried with it. I was angry with it. I did all, went through all the emotions, but on the whole, that I average out with, I am thankful that that happened because it changed my life in a good way.
hmm.
And I can even go even farther back to my dad's cancer when I was 17 and he passed away. And I can still say the same exact thing now that I've processed it and used the same formula, that I can say, I'm thankful that it happened the way it did because it changed my life and it brought me to this moment where I am able to help other people with body focused repetitive behaviors.
Yeah. And I had the other side where, as a therapist, when my wife died 2 years ago from cancer, uh, fu cancer, by the way. That's all I want to say. Yeah. Just, oh, wow. We just got that on camera. That was awesome.
Sorry. But you know what?
No, it's true though. Just F you, cancer. Uh, but I had to apply everything that I tell the members that I work with to myself. You'd be like, what a hypocrite I would be if I was telling others to take care of themselves and to do things and not do it for myself. So I agree. I had to do that. That was really important.
And it takes time. It takes time to get to a place where it it feels fully healed. Um, but this mentality that we're talking about, right? I think it just helps speed that process up.
Yeah. So, body focused repetitive behaviors, excoriation or skin picking, trichotillomania, hair pulling, nail biting. There's also like the ones that don't have real names, like biting the inside of your cheek is a big one, or lip pulling and skin.
Lip
That
picking, nose
yeah.
picking. I mean, I have mild ones of all of those. I think
Hmm.
where you find one, again, even within BFRBs, where you find one, you probably have a few tendencies because
Hmm.
at its core, they're self-soothing mechanisms, and it's sort
Yeah.
of like the grooming gene gone awry.
And it's not just the hair on your head. It could be your eyebrows. It could be your genitals. It could be your legs. It could be your arms,
Yep,
armpits, anything, right?
anything, anywhere. Yep,
Hmm.
across the body. Exactly. Yeah.
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 Is there any particular age these seem to develop, or is it across the lifespan? Or what do
You
we see?
know, it's really interesting. There's research on trichotillomania specifically. There's not as much, I think, on skin picking and nail biting, um, but there does seem to be a baby trick, is what it's called, which is somewhat different from
Mm-hmm.
regular trick, which seems to happen around puberty. But
Mm-hmm.
then I think I've seen now, with through HabitAware, we offer a smart bracelet, we offer peer coaching, we have an online community. We've talked to hundreds of thousands of people across
Hmm.
age ranges, genders, regions of the world, and the common things we see are around puberty, are around pregnancy,
Hmm.
are around menopause.
Hmm.
And so I think we need to start researching the hormonal component. And what's interesting is even the research used to show that it was predominantly women, but now more recent research is showing it's actually 50-50
Hmm. Hmm.
gender-wise. And I think the change is in women probably sought help more
Hmm.
because it was probably more acceptable for women to seek mental health help, right? Like men
Hmm.
are taught to buck up and, you know, quit crying, which is not right. Um, and I think for men also there were some easy outs in terms of they could just shave their head or they could just shave their beard and their mustache and their
Right.
problem
Right.
sort of goes away, right?
Hmm.
But what if you do want a full beard and a mustache or a full head of hair? And so I think we're seeing a shift towards more men actually joining our community as well because of that.
Okay. Now, is this a pleasure pain experience that I get from it? Is it boredom? Is it anxiety? Is it all of them potentially? What is kind of the driver, do you
Yeah,
think?
that is such a great question because there's also a lot of people who think of this and say, "Oh, you pick at your skin or you pull your hair and look at like the infection you've created or the bald spot you've made, like you're harming yourself." And the intention is different than self-harm. It really is a soothing mechanism. It really is this behavior that our subconscious brain is going to automatically because it's in a state of imbalance and it's trying to re-regulate back to that state of calm. So it really is a self-soothing mechanism. Um, but there is that like it may hurt but it's still somehow in the brain feels good, like that little
That endorphin and dopamine kind of hit kind of
yeah,
thing. Yeah.
whatever
Hmm.
chemical it is that's
Yeah.
saying,
Hmm.
"Yes, give me more
Yeah.
of that. That feels
Yeah.
good." Right?
I'll
It's
take some endorphins. Yeah.
yeah.
That's,
And
mhm.
I also wanna just preface, which because I didn't in the beginning, everything I'm saying here is coming from lived experience and
Sure.
through our work. I am not a trained mental health professional, um, but we have 2,500 plus treatment professionals recommending our product and seeking out our advice because we understand these behaviors so deeply.
Yeah. And just a plug on this, NOCD, we treat people with habit reversal treatment, and your product goes along nicely with
Yep.
HRT work, also.
That's
So,
exactly it. It's the first step
mhm.
of habit reversal training. So yeah, like if
Is
someone
awareness, right?
is yep,
Correct. Hmm.
exactly. Awareness,
Yep.
exactly that.
Yeah. And by the way, just thank you everyone for joining. Tonight's webinar brought to you by NOCD. NOCD, an online platform for the treatment of OCD and related conditions like body focused repetitive behaviors
Mhm.
and tics and hoarding. If you're looking for help for OCD, check us out at nocd.com or treatmyocd.com. We'd be more than happy to work with you. We've got people on our care team standing by, ready to make appointments with you. And Aneela, I'm going to give you a little platform at the end to
Oh
tell
yeah.
everybody all about your product and
No worries,
everything.
no
What do you
worries.
got coming up?
Yep.
Now, uh, there are questions, and you kind of alluded to this. There's self injurious behavior, there's things that stimulate us, there's a body focused repetitive behavior. What kind of things do you talk about in terms of defining the differences between all of those?
Yeah, so for us it's really about the intention. Like
Mhm.
when people are hair pulling because they're mad at themselves and they want to feel that pain, that's hair pulling, that's maybe self-harm, but it's
Yeah,
not doesn't meet the medical definition of trichotillomania, which is
right.
self-soothing.
Hmm.
So even so it's this is where it gets like very gray because the same behavior depending on the intention is a different mental health issue. you know? It's either self-harm or it's self-soothing, meaning it's a BFRB. And so when you can understand why am I doing this, then you can find the right treatment. And that's really also why when we talk about OCD and related behaviors, it's really good to understand how are they related and how are they not, and where the treatments sort of start diverging so that you get the best care and you can advocate for that care.
Yeah. And how much does anxiety and boredom play in this? Because I hear both ends, right? I notice that I pull or pick more when I'm anxious, or I don't even know I'm doing it. I'm just sitting there watching TV. There's nothing going on. And I look down and, oh my God, there's a pile of hair sitting on my lap or on the floor or on the table or something like that.
Yeah.
So it could be both, right? I mean, it's a
Yeah.
possibility. Yeah.
Yeah, we say it's anything that's getting you off your baseline. So that could be overwhelm, so stress, anxiety, it could be underwhelm, boredom, and it could be like physical states in between, like you're thirsty, you're hungry, you're tired, you have to go to the bathroom. That was one of the things in using the bracelet. It finally clicked for me during the day. I would be pulling at work, typing away, working in a very stressful advertising environment. I would be at my desk all day long from 10 a.m. to 9 p.m. The only time I would get up was to go to a meeting. I wouldn't go to the bathroom. I wouldn't get up for lunch. I would not take breaks. Like I was pushing, pushing, pushing. So it was this mix of stress, anxiety, and me simply just needing to go to the bathroom. Like my water has become my daytime go-to because it allows me to take breaks. It allows me to go to the bathroom. It provides me with this mini break every time I take a sip. And that one simple shift has made an immense difference. So really that understanding of what is getting you off the baseline really allows you to figure out what's the right thing to bring you back to that state of calm. And one of the emotions that I didn't mention, when you get off your baseline and something good happens, you're getting off your baseline, right? So people, if you're happy, if you're excited, that actually might also be causing this scenario. I did a peer coaching call once with a little girl who was like 8 years old in Australia, and I asked her, when does it happen? And she said, oh, I pull when I'm playing games with my sister, board games with my sister. And I asked why, and she's like, because I'm winning, right? And so we really need to understand, here we are traveling along this road, calm, cool, collected. Something happens. What is it? What do we need to get back to that calm, cool, collected state?
Yeah. And I'm seeing people on just some of the comments as I'm scrolling through about, oh,
Oh,
I started doing this when I was a kid, or one person went from the hair to the lip, or the mouth chewing, some of these things. So yeah,
yep.
definitely.
All of these
You know,
things, and I still, cheek bite a little bit and lip pick and lip bite. One of my favorite things is I just make a bowl of grapes and raisins and carrots and snap peas in the morning and almonds, and I
hmm
just chew those instead of my cheeks. And it's a nice little strategy for if someone wants to try it.
Yeah. And for those listening, there are differences in the therapies, obviously, between what we do in OCD and what we're going to do for trichotillomania and habit reversal, right? There, people with OCD have this awareness, right, that they're going into these compulsions. They recognize these things, but people people with some of the body focused repetitive behaviors may go for hours without knowing they're doing so, until the damage is unfortunately at times really done, right? And people have really damaged their skin or their hair follicles. There's even a trichobazar. Do you want to tell everybody what that is?
Yeah. So yeah, absolutely right. These can, just like OCD, there's a spectrum
Yeah.
of how severe it gets for people. And so with skin picking especially, it can get very severe to the point where if you're getting skin infections, I mean, I have a friend personally, she's turned her, just like I have, she's turned her pain into purpose. Her name is Lauren McKinney, and she started this organization called the Picking Me Foundation. And the reason she started it is because she has skin picking, and she picked a hole into her leg that was so severely infected that she nearly had to do surgery to amputate her leg. Luckily, she was able to work with the doctors that that didn't happen, but it hit such an extreme for her that she realized, I need to do something. I need to get better. And as she started getting better, she started this organization to raise awareness for skin picking specifically. So anyone in the comments and who's listening, like check out pickingme.org. It's a fabulous organization. And then, yeah, to your point, trichobazars is when, again, something we don't talk about because it's quote unquote weird. Some people will pull out their hair and then eat it. And our stomachs don't have the enzymes to break down the hair. So it kind of just sits there and it sits there. And if this becomes that repetitive cycle, it winds up creating like a hairball in your belly, and it creates, digestive tract issues, which then requires surgery. And so, um, those are two examples of how this can go to the extreme where it's really impacting your life. I mean, just the bald patches, it's getting to that social anxiety, that shame. And what we don't talk about a lot is that depth of um, how painful this condition is for people. I think that's also part of the reason why it's not talked about as much. Like it's just sort of seen as like, again, oh, like, oh, you just pull out your hair, like that's weird, go away. Like, like but with OCD and with depression and with anxiety, there's like a deeper understanding. And honestly, with OCD, I mean, we throw that adjective around unnecessarily, but
Mm-hmm.
but there's a little bit more understanding where people have a little bit more compassion and care towards someone when they're talking about about those conditions. So I'm really glad that we're having this conversation today,
Mm-hmm.
uh, because it's really important. And I'm sure that there's people in our BFRB community that have an OCD, and there's people in the OCD community that have BFRBs. And
Yes.
wouldn't it be nice to work on both?
Absolutely. Quentin here says, I was just stuck in a skin picking loop that felt unstoppable as a hand washing used to be with his OCD. How do you think about the experience of being unable to stop compulsions or BFRBs once they start? Did it feel that way to you, that it was just unstoppable, or how was it?
Yeah, I mean, it really is this like loop that it's so hard. Like before the bracelet, before that vibration, before that awareness, people will even say, "Oh, I know when I'm picking. Like, I know when I'm getting up and I'm grabbing my tweezers." Even I used to. I knew when I was getting up, getting my tweezers, and going to pick, going to like tweeze my eyebrows, but I didn't have control. And that's what the bracelet kind of delivers. Is it that vibration shifts it to the conscious mind where you have control, and so that vicious loop that person talked about. I'm trying to find the actual comment because I saw it too earlier. Oh, Quentin.
Oh,
Um,
Quentin, yeah. Mhm.
that vicious unstoppable loop. It's like you want to stop, but it's kind of like the bag of potato chips. You're supposed to just have one or two, but you just can't because they just taste so good. It just feels so good. Like, I know I should stop, but one more. Let me just get that one more. Oh, I didn't get the one I wanted. Let me get one more. And it
Mhm.
just keeps going until boom, the thing's gone. The entire eyebrow's gone. But that's the work. That's the work, is build awareness. That's the first step of habit reversal training. Then train yourself to replace the behavior. Then train yourself to fulfill the need, and then surround yourself with like-minded community. That's the third step, is support training, with like-minded community that can keep you going on this, because we have to think of mental health in the same way we think of physical health, in the same way we think of chronic physical health, in the
Yes.
sense that it is something we need to learn to manage. And so I always liken it to diabetes, where with diabetes, you have to constantly monitor your blood sugar levels, your finger pricks, whatever it is, to what you're eating. You're constantly every day managing these different inputs and outputs. And it's the same with your BFRB. Every day it's work, but you know what? It's fulfilling work, and you're worth it. Like, it's worth that effort to have a life where you're not pulled down by this thing.
Yeah. Well, we say that with OCD too.
Yep.
Um, there's a couple things on here. Joe talks about there are days that he does exercise and it feels like compulsions seem to disappear.
Mhm.
And then, is what if I just did that every day? Would that help? Were there days that you also felt that, where there were days that were easier than other days? And
Absolutely. So we advocate for an integrative approach. That means
yep.
mind, body, soul to us, and that is healthy eating, good sleep. Uh,
Hmm. Hmm.
we say, what are you feeding yourself in terms of the food, but also in terms of the content you're watching? Like,
Yes.
if you're watching scary movies all the time, like you're keeping your body in that scary state, right? And
Hmm.
so movement is medicine,
Hmm.
100%. Um, yeah, I mean, and that's sort of what I mean when I say it's work. It's work because it's about making these lifestyle shifts that ensure that you go to bed by 10:30 and you get
Yep.
up in the morning with enough time to go for that walk or that run or whatever exercise you choose, dancing while you make breakfast for the kids, whatever it is that brings you joy also. And that's why it's like work is like the worst word to use, because ultimately all this thing is asking you to do is take care of me. And what better way to take care of yourself than to do the things you love, you know? And so it's really just saying, love me.
Hmm.
So yeah, like those days where I can get the sleep I need, I can eat really well, I've gotten some movement in, walking my dog is my favorite way. I played with my kids, I filled my cup. These hands don't need to be noisy. They don't need to say, Aneela, wake up, Aneela, take care of me, because I've already
Hmm.
done it. I've done
Hmm.
that work.
Yeah. Yeah. And for someone like Joe, there are, I think that there are always fluctuations. There's always up and downs. There are days that people with really difficult OCD might have gotten great sleep. Maybe they ate really well the day before. They woke up with a spring in their step. They felt really good, and they thought, "Oh my gosh, finally, this is it." And then tomorrow could be back to where they were, and that can be so self defeating for a lot of people.
Yep.
What I tell people is be careful about setting a lot of goals in the sense that I have to be ready by this, or be okay by this date,
Yeah.
or um, hey, I can let up now because I'm feeling so much better. One of the things that when I worked inpatient and I would work with people who had significant serious mental health issues like schizophrenia, psychosis, or something, many of the people, when they would get released from the hospital, would think, I'm okay now, so I'm going to stop my medicine because they let me out of the hospital.
Mhm.
And then, of course, they would relapse and be back in the hospital again because it was the medicines and everything, the whole combined of things that did it. And when we give up on those things, right,
Yep.
that are good for us and are helping us, that's
Yep.
when we start to fall back a little bit. So,
Yeah.
you
This
know,
is this is I mean, I've seen it in my own life. Oh, I'm doing so well. I don't need to do my morning prayer. I can sleep in a little bit. Like they start slacking off. Write this down. Don't stop what's working. If it's working, if you feel yourself getting better, keep doing it. Keep going to your therapy appointments, keep taking the medication, keep doing the strategies that are working, because that means you are changing your life. Those things will become your lifestyle. And once it becomes your lifestyle, it becomes your go to automatic behavior, and you don't need to think about it. And so that's the number one thing that I learned. Like my therapist was like, Aneela, we're kind of like reaching an end here. And I'm like, nope, we are not, you are not getting rid of me. We don't
mhm,
meet now, we meet every 6 weeks, which is
mhm,
a good amount of time.
mhm,
But I told her, like, I still need to meet with you. Like, this is working. This is what keeps me going. So now I know, in ahead of when I'm meeting with her, that I want to be able to tell her good things. There's that accountability. So absolutely, if you see things working, it's not like, oh, I've washed myself of this. It's more, I have the toolkit now that is going to keep this thing at bay, and I'm going to wear that toolkit instead of that heavy bag and that heavy burden. And so, really, that is key. I love that you
yeah,
said that.
yeah. Nicole M.A. says, has anyone had intrusive thoughts inception, obsessive thoughts over each other? Nicole, I don't know what intrusive thoughts inception is, so I would like if you could throw some more explanation in there. That would be wonderful. We did get one that came in through another site. It said, I'm scared there are germs on my face like acne, and I try to pick them to get rid of them. Is this OCD or a BFRB? I'm leaning more on OCD on something like that, but I would like your thought on that.
I'm not a treatment professional,
Yeah.
so I wouldn't
Mhm.
even want to venture a guess.
Yeah.
But yeah, like I think this is again something that talking with a treatment professional that
Right.
understands both may then be able to leverage what they know about both to come up with a strategy that works best for this scenario because
Hmm.
it may be, that might be the right approach. Oh God, no, I shouldn't even go there. I'm
No,
not a
no, it's good.
professional.
Yeah. I like this one. One of our longtime listeners, Terracotta Chabata, hello,
Yes.
says, I've been told to get my OCD under control, I need to delay my compulsions as well as be comfortable with being uncomfortable. Is there any ERP ideas you can give me for being afraid of feeling my feelings? Which I like because I think that one sometimes people with BFRB may turn to those behaviors as a way to try to
Yep.
avoid other feelings, and that's different than what we want because both of us want people to feel their feelings and
Yeah.
learn ways to manage them without doing compulsions or any kind of BFRB work, correct?
Yeah, absolutely. And I think that's probably actually where the like because I've been trying to figure out like this the where the two sort of split, like they are related, so they're walking down the same path, and then
Yeah.
where do they sort of split? And I think maybe it's the answer might be hidden in this question a little bit of um there's those thoughts and feelings that we're trying to like push back down, right?
Hmm.
And one way to do that happens to manifest as body focused repetitive behaviors, hair pulling, skin picking, nail biting, where our brain says, oh, that feels good, and they kind of forget about the unwanted feeling. And then it feels like with OCD, it turns to I need to do this compulsion to get to like tamper down and sort of tell that unhelpful feeling like it's
Yeah.
going to be okay, but then you get caught in that loop of the compulsion. Is
Yeah,
that
there's definitely a lot of that, and I also know that for BFRB, I don't have to have a conscious kind of thought or image or urge that leads to it, right?
right?
And that I think is another big differentiator in it. Now, the with the way that DSM classifies things, for those who are not familiar, the Diagnostic and Statistical Manual of Mental Health Disorders, which is what the American Psychiatric Association puts out to
Thank you
give
for
us
knowing that acronym.
our sure, our definition of conditions, has put OCD, body focused repetitive behaviors, tics, and hoarding all into a OCD and related conditions. Likely because of what appeared to be some kind of compulsive behaviors. So, tics have uncontrolled potential behaviors, which from Doug Woods we know are far more able to be controlled than we ever thought possible.
Mhm.
BFRBs, which have these repetitive behaviors, right? OCD, repetitive behaviors, and hoarding, probably a lot of repetitive behaviors. So,
Mhm.
but they're also probably classified that way by because it's the psychiatrists that run it. Response to medication, genetic studies, and things. There's less focus in the DSM really on treatment response than there is to medication and genetic kind of loadings on things. But that's probably where some of the similarities at least lie with this. And they are both treated with a behavioral based therapy for sure.
Yeah.
And now I am less familiar, and I know you're not a clinician, so just speaking in general, but have you found or seen from your work that are there any classes of medication that seem to be more helpful for BFRBs at all? I'm not sure.
Yeah, what we haven't really there is some research on NAC, which is an assist I'm gonna botch it. It's
Yeah.
NAC. It's and there's some research on it, but it really does seem like it's something that's like talk with a professional, see if it's
Hmm.
right for you, experiment with it in a sense with a treatment professional and see if it works kind of thing. There's nothing out there that is specifically designed, if you will, by a pharmaceutical company for BFRBs. Um, so yeah, I mean, everybody's waiting for a magic pill for any and every condition. I like to say you are the magic pill. Like when you
Yeah.
start to do this again, I hate to use the word work, when you start to do this joyful work,
Hmm.
um, and start changing your life, making those lifestyle changes. And as you were saying before, like give yourself grace. Like you're not gonna do it for a full week and then you're boom, it's gonna like you're gonna have these ups and downs. I mean, I just started going to the gym last week. I went to the gym 5 days in a row, which I've never done before, and then my back blew out on
Hmm.
me,
Yeah.
right? So like here I am doing everything I'm supposed to be doing, and then my body's like, nah, chill out.
Yeah.
So in that same way, okay, next week I'm gonna go 3 times instead of 5 times so that I can get back into it and ease myself into the change that I know I need to make, right? So
Hmm.
like yeah, so no treatment, no medications that I know of at this point, really. I'm sure that there are people working on it, but I also truly believe
Yeah.
in mind body soul connection.
Do the work. Right.
Do the work
Hmm.
with the right people by your side.
Just to continue on with our friend Terracotta Chabana, she says, it's hard when I don't know how to do that, feel feelings. I'm so afraid to let go of compulsions. There are that, and this is the hard thing. Even Taylor talks about doing ERP seems impossible.
Mhm.
He's or she, I don't know. I'll just say Taylor is convinced that they are the worst human capable of the worst things in the world. I've always said whenever I am at the OCD conference, I am either gathered among the most dangerous, worst, most awful, horrible people in the world, or I am gathered amongst people with OCD. It is one or the other. But uh, with all of the intrusive thoughts that people have with OCD, and all of the time that I have spent with them, and all of the conventions that I have gone to, I if people were as bad as they said that they were, how I'm alive is nothing short of miraculous. I should have been murdered and molested and all sorts of things so
Mhm.
many times over
Yep.
by the OCD community if they were as dangerous
Yep.
as their OCD tells them they are.
Yeah.
Or the luck of the Irish truly applies to a guy named Patrick McGrath, and that is why I am alive to this day. But I think it's interesting there where, again, I'm afraid to let go of compulsions, Terracotta says. And I see this a lot where people really do believe the one thing in their life that is keeping them afloat is these compulsions. OCD is so amazingly convincing to people that it is the reason, just purely by compulsions, that they haven't given in to any of these terrible, awful obsessions.
Mhm.
And the fact that we can be so pulled into certain behaviors is, I think, the common denominator then between
Mm.
what I do and what you really work on.
Yeah.
This notion of these behaviors are amazingly powerful,
Mhm.
and they really do something to us, but just because they do something doesn't mean they do good when we do them, right?
Absolutely. And it's our brain. It's remember that it's our brain that's really powerful. And
Hmm.
so we can, just like we can learn to go from lifting 5 pounds to 50 pounds, we can learn to kind of have that control over the brain. Um, the more that we can have that conscious control of what we're doing. And so again, that mind, body, soul, integrative approach, meditation, mindfulness, these practices are centuries old and now being proven by today's science to reduce anxiety, depression, and all of these other things, and to actually like hone the brain's ability to think and to think clearly and all of these things. And so it's really important that that holistic approach is taken with both of these conditions.
Yeah, yeah. It is a full spectrum of things to be done to help people, right? And
And I'm just seeing in the comments, Michelle
yeah,
Jaffe,
I'm looking at them too. Yeah.
a link between BFRBs and OCD. And so hopefully we're answering that. I haven't scrolled down. I'm
Hmm.
20 minutes behind in comments.
Yeah, that's okay. That's okay.
But hopefully that's what we're kind of discussing is the differences and the links. Um,
Hmm.
Carissa asked, could you talk about the trance state? I often don't realize I'm doing it. And I think earlier, Carissa, you may have mentioned that you had, I want to say it was skin picking, but now I can't remember because there's so many
Hmm.
comments.
Yeah.
But yeah, I mean, the trance is real. And maybe trance is, an altered state of consciousness. Essentially, it's we're working on something else and we start pulling. We don't realize it's happening, or I'm driving, and I mean, even driving is an altered state of consciousness if you think about it, right? Driving, think about the last time you drove somewhere and you went from your car to the parking spot, and could you recite every single turn and every single red light and green light? No, it's so automatic.
Hmm.
And so that's what these behaviors are. It's like that, where it's just so automatic. It's that subconscious reptile brain at play. And so um that's why um breaking that trance is so key, because you can't change what you don't know is happening. You can't change what you can't control. And when you break that, um it's like those hypnosis classes, like woo woo woo, right? When you break that,
Hmm.
the person wakes up and is back in control. And that's sort of what the vibration is doing, is it breaks that trance, it shifts it to the consciousness to then allow you to now say, okay, what do I need, and fulfill that need.
Ah, here's a great one. HG says the snapping of the rubber band on the wrist is not great for OCD. So, what is the mechanism of the vibrating bracelet? So, I'll address the snapping of the rubber band first. It is not great because it's a punishment, right? The idea was, oh, every time I have it, I'm going to do that to punish myself out of OCD.
Yep.
The vibration is not a punishment. The vibration is to create awareness, right, Aneela?
Exactly. And people will also say, talk about snapping a rubber band in this community as well, in the BFRB
Hmm.
community. But again, you can't snap something if you don't realize it's happening, right?
Right.
If you don't know what's happening. So you need that awareness. And exactly your point, punishment. What we talked about earlier, you cannot fight. You
Yeah.
must find a way to love, and that's how it releases the hold. So
Mhm.
that rubber band, punishment, 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 you're just telling your that's the story you're telling yourself. And
Yeah. I've
that's we need to meet ourselves with love. We need to learn how to do that. And so that mechanism of the vibration, it's using like motion sensors to match whatever behavior you've put on the bracelet. So in the app, you can record your specific gesture, and then that vibration again. And again, it's about mindset. So you could think of it as that punishment snapping rubber band, and that will put you on a different track to recovery, versus this is my buddy, this is my hug on the wrist, and it's going to help
yeah.
me.
Yeah. That is saying to you when you don't know you're doing it, hey, by the way, you're doing something that you're not aware you're
Yeah,
doing. And
exactly.
now you have an opportunity to intervene that you didn't have before because you didn't know before.
Yeah.
Hmm.
Shout out to Alex. She wrote, it's maintenance consistency. Yes.
Hmm. Yeah. Love Lana says, I stopped biting my nails 2 years ago after having done it her entire life. Thank you, Love Lana, for
That's
sharing.
awesome.
Uh-huh. Yeah.
Oh,
It
Pat.
is.
Yeah.
Oh, go ahead. Go ahead.
I was
Hmm.
just gonna say, Patrick, love never fails. I now avoid movies that make me anxious once I realize the link to my BFRB. Me too. I stopped watching TV, and now I'll only watch like Friends or Saturday Night Live, because
Hmm.
I just want to watch fun things that make me laugh.
Hmm. Yeah. Um, Yeah, and some people are throwing out there some like psychedelics or things. They're
Mm,
being studied for lots of stuff. I'm
yeah,
sure they're being studied for BFRBs. They're being looked at for
yeah,
OCD. There's a
sure.
lot of those different things that are out there. That's for sure.
Yep. I'm sure that
Uh,
this stuff, I see some of those things. I think whoever, memantine, ketamine, I'm sure that exactly that.
Carissa says, yes, my therapist also thinks my BFRBs are avoidance of feelings.
Mm.
Mm-hmm. Now, to its extreme, right? When it's a purposeful experience, this is not a BFRB. When we're going into non-suicidal self-injury,
Mhm.
that has been a way that people have also tried to deal with it. I don't like this feeling. I can create another feeling. I can be in control of that feeling, and therefore that somehow feels more comfortable potentially to me than this other feeling that is elusive and I don't understand it so much and I'm not in control of it and other
Mhm.
people can manipulate it. This is me. This is me in control.
Yeah,
And
yeah,
so again, BFRB is a very different experience than that, right?
yeah, yeah. I think so. Um. Actually, wait. Can you repeat it again? Because I think. Can you repeat what you said again?
Yeah, I was just saying that people who are doing purposeful self injury, like hitting themselves, cutting, or burning themselves,
Mhm.
are creating an experience that they feel like they can be in control of. And in a physical kind of state versus this potential emotional thing that's going on over here that they might be trying to avoid and get away from when they're doing that.
Yeah. Okay. All right. So
Versus that's not what we're talking about in
yeah, yeah.
BFRBs at
Yep.
all, right?
Yeah.
A
I
very
think
different
it's
thing.
more. It's more
Hmm.
like. Yeah. To me, it's more BFRBs are more like the state of imbalance, the state of discomfort,
Yeah,
and it just feels better over here.
right.
Versus like something has happened and now I'm angry at myself and so I have to
Yeah,
punish myself. Yep.
right.
Yeah. Okay.
Yeah.
All right.
I've not met people who are pulling at their hair to punish themselves who have BFRBs, but
Right.
there are people who may grab their hair and try to pull it out as self injury
As
because they're mad at themselves or
self-injury,
something like that.
self-harm, right?
Yeah,
Then it wouldn't be medically known as trichotillomania, which is
right.
medical
Right.
condition. Yep. Exactly.
HG has I like HG's being provocative
Yeah.
here.
I like it.
So I'm going to throw it at you. Would it
Do
be
it.
better to teach people mindfulness techniques to increase their present moment awareness?
That is exactly what we are doing, HG.
I agree.
I don't wear the bracelet anymore. I know as soon as my hands go up to my eyebrows and I
Mm-hmm.
have control. So that is exactly what we are doing is that this device teaches you to build awareness
Mm-hmm.
so that at some point you can put it in a drawer. And now I take it off for to show everybody
Mm-hmm.
and I took wear it, for yeah, so for like events like this and I wear it like during COVID there was time where I just was falling back. I mean,
Mm-hmm.
rightfully so, we were all going through such a hard time. I put my bracelets back on.
Mm-hmm.
And so that's exactly what we're doing is teaching people using technology to teach mindfulness, to increase their present moment awareness so they don't need this anymore. And so that they understand that full cycle of what they need to do when their hands go to an area they don't want their hands to be in.
Yeah, absolutely. Mm-hmm. Brett talked about some trauma during the hurricane. Shout out to all of our friends out there. We're thinking of you. I mean, what a week! We had a hurricane on one coast, we had a tsunami on another coast, all at the same time. It was ridiculous, just absolutely
You know,
crazy.
just as the body talks to us, the body is talking to us. These BFRBs are the body talking to us. We need something. I think the earth is trying to tell us something too. The earth is talking to us. We need to be taking action, loving action. So
Mhm.
let's start with ourselves first
Yeah.
here.
Brett says, experiencing dissociation and derealization. How can I reduce the
Mm.
severity and duration of these symptoms? If we were in a standard therapeutic treatment, I would do some interoceptive exposure with you, Brett. Right? I would say we're going to practice purposely creating some of the symptoms of that to teach you how to handle them. But when you're in the midst of something right now, your job is to function and survive. Really, that's what we're really talking about. So, Brett, whatever mindfulness techniques you may have learned, you know these are the times to really use them, and we hope that you're able to stay safe. If
Mm.
you do have an OCD therapist or a therapist you can get to, either physically or you have service back, please reach out to them and you know do what you can to help. And again, for anybody who's been through any difficult situations like that, at NOCD we work with people who've had traumatic experiences too. Check us out at nocd.com. We would be more than happy to try to help as much as possible. Can we talk about how distraction can become a compulsion? Is there awareness apps that help that? That's interesting.
Very
And can the bracelet help if you have a mild BFRB just during stressful periods? Is the other question.
sure. I feel like the first one is for you. If
Yeah, I'll take. But you go ahead and answer the second one first.
Sure.
I'll take the.
So, yeah, with regard to can the bracelet help with mild BFRBs? Absolutely. Like I said, now I kind of just mostly wear it during very stressful periods, and we see that with people where they'll learn, they'll build their awareness, they'll create their toolkit, and then they take it out when they need it, such as these examples that we're talking about. So, absolutely, it could be used to help in those scenarios.
Mm-hmm. And in terms of distraction becoming a compulsion, there are 5 safety behaviors, right? Let's talk about the 5 safety behaviors for a few minutes here. Number 1 is avoidance. I will avoid anything that's uncomfortable. And in doing so, I will never learn how to handle that thing because I will always avoid that thing. And therefore, that thing will always be um, a thing that is tough for me to handle, right? Number 2, well, reassurance seeking, right? There's tons of people who are going to be doing lots of reassurance, right? And what happens when we do reassurance seeking? A couple of things. Number 1, we can put onto everybody else anything that goes wrong. So if I'm seeking reassurance from somebody and I have them tell me that I'll be fine and that everything will be okay, well, guess what happens? Now, if something goes wrong, I get to blame them, right? I can say, I would have never done it had you not told me that you would be fine and everything would be okay. So that's
Yeah.
one reason to not do reassurance. Number 2, reassurance is like a drug. You build up a tolerance to it and you need more and more reassurance over time. That's what you need, right? That is absolutely the thing that we need. The third thing is distraction. We want people fully engaging in the experience without distracting themselves from it. So if you find yourself in a difficult situation that you're working on therapeutically, and then you're like, I can't handle this, so I'm going to watch kittens running through a field. Oh my gosh, look at the kittens! Aren't they the most cute little things in the world? They can run through the field, right? That's the thing, right? That we don't want people doing. Again, therapeutically. Now, I'm going to go back to Brett, and Brett says, "Thanks for the advice and the kind words." Thank you, Brett. When you find yourself in a situation, though, like where you're in the midst of a hurricane and things are blowing all around you, your job, number 1, is to get to safety and do all that you can to keep yourself safe, right? I want you to avoid all of the things flying around. And if people are telling you, we got to get out of here, we're going to be fine, let's go, I'm not saying in the midst of an amazingly dangerous situation like that these are bad behaviors. But when things are calm, when things are kind of day to day, but we're relying on these safety behaviors as ways to get through life, that's when they start to interfere with things, right? Just look at somebody who has agoraphobia, where their life just gets smaller and smaller and smaller to the point they may not leave their bedroom or their bathroom. Those are the only 2 rooms they go to, right? Why? Because they're avoiding everything. How come? Because even outside of my bedroom, what if I have a panic attack? This seems to be the only place that I feel safe whatsoever, right? So that's just things to really kind of pay attention. The fourth thing, so we have avoidance, reassurance, distraction. The fourth one, substance use, right? Many people will turn to using substances as a way to try to deal with intrusive thoughts or images or urges or even behaviors that they might be doing as a way to try to avoid things. And unfortunately, we know this, about a third of people with OCD will experiment with some substances at some point to try to deal with the intrusive thoughts and images and urges that they have. And then finally, we will have the last thing that's out there, compulsions. And that's what we have with OCD, right? So um, you will get people who will do mental or behavioral compulsions as a way to deal with this. And because of that, well, people stay stuck, right? Because if compulsions worked, we would recommend that people do compulsions as a way to manage their life. I would go up to people and say, hey, appears to be that things are going a little bit difficult for you. Have you considered some compulsions? might be kind of helpful, right? I would never say that to anybody. I
Right.
would never go recommend that anybody uses any kind of compulsions whatsoever. So we always want people to be aware of safety behaviors because they can definitely get in the way of people doing the therapeutic work that they need to do. Because when we're talking about OCD, what do we want people to do? We want people to, going back to what Terracotta Chabata said, feel
Mhm.
the feelings. We want people to learn that they can handle the discomfort. We want people to know that, you know, you can deal with whatever it is that pops in your head. We had someone earlier say they feel like they're the worst person in the world. Uh, I have done OCD treatment for 25 years. I've absorbed pretty much every OCD intrusive thought, image, or urge of anybody I've ever treated. That would make me also one of the worst people in the world, too. Like, I tell you right now, I cannot drive a car down the street and see a bicycle rider without assigning a point value to them and then consider running them over to get the points. It's just something that I do while I'm driving. So, am I also one of the worst people in the world? Or am I just a guy who treats OCD who seems to have absorbed a lot of intrusive thoughts and images and urges? So,
Right.
that being said, Aneela, I wanted to give you a little bit of time to tell everybody about HabitAware, and FYI, this is NOCD is not an endorser of any products or anything. I'm just happy to have you be able to come here and tell about the work you've done and what your company has done for those with BFRBs, just like what NOCD has done for people with OCD. So.
Exactly. Yeah, I appreciate the time. I'm so fascinated by the safety behaviors and the five. These I want to stay on and 1,000 questions.
Mhm.
It's just so fascinating. So we're here today because in the DSM-5, as Dr. McGrath mentioned, body focused repetitive behaviors is labeled medically described as OCD and related as an OCD and related behavior. And so we're here because the treatment professionals, the scientists, the researchers have put BFRBs and OCD in the same family. But they are different. And so we wanted here today it's BFRB Awareness Week. We wanted to raise awareness of BFRBs together.
Yes,
Um,
happy BFRB Awareness Weekend.
BFRB Awareness Week and Happy OCD Awareness Month.
Yeah,
Um,
thank you, thank you.
wanted to, this is about awareness of both of these conditions, an understanding of both of these conditions, understanding where they the path that they're on together and where they split so that you can get the best treatment, the right treatment for either one. There are no conflicts of interest. No CD is, I would say, no CD and HabitAware are friends.
Yeah.
We serve similar communities, probably some overlap, and um, financial interest in the product. I'm just looking down the comments here.
Mhm,
I own HabitAware. I'm one of the co-founders. It's what pays my bills, but
mhm.
that's about it. Someone mentioned if there's clinical research. So great question. Thank you for asking. Um, HabitAware has a NIH phase 1 for trichotillomania, which is complete, that essentially proved feasibility and sort of proved out this idea of like awareness, behavior change. There's more there. And so right now we're working on our phase 2 to build out a system of awareness and habit reversal training with the mobile app that again teaches this whole system, allowing the person to create that mindfulness on their, like, get to that point of true mindfulness on their own. And then we're actually also have another research grant with the NIH to adapt the technology for overeating conditions. So
Mm,
similar idea of
okay.
gesture detection. And so we're working with researchers at the University of Minnesota. I wish we could figure out a way to get something like this inside our brain so we could hear those intrusive thoughts, and it can, send a little vibration out here saying, "Don't think
Hey.
that. Do what Dr. McGrath wants you to do." Do
Or
your
it teaches you more than anything, really. I would change that slightly. I would say we all have those thoughts.
Yeah,
But if you start to go down the road of the compulsion, then
right.
hey,
Exactly.
now be careful. Yeah. So
Exactly, right?
definitely,
Exactly. So
yeah.
maybe one day we'll get there.
Hmm.
And you can get the bracelet at HabitAware.com. You can email me at Aneela@HabitAware.com if you have any questions. Just my name's right there. Or find us on Instagram in the DMs. It's usually me answering those. I love meeting the community. We do so many like connection calls. We have just so many offerings to the community. And one more thing, we have any tactics you recommend for giving yourself grace after a BFRB relapse? SGP. I think the biggest thing to remember after a relapse is you are not starting from zero.
Right.
You are, and I'm sure it's this. It's probably a
You
similar.
say that for OCD too.
Yeah,
Absolutely.
it's similar,
Yep.
right? It's you have so much more deeper self-awareness, self-understanding, knowledge, understanding of the conditions that when you pick yourself back up, you just have so much more in you to go forward. And so really the tactic for giving yourself grace after a relapse is to just give yourself grace. I know it sounds silly, but we are so quick to be hard on ourselves.
Yeah.
And to catch that and reverse whatever it is you may have just said. Like I used to say, "Oh, Aneela, why did you just do that? You're so dumb. You're so ugly." "Oh, Aneela, are you okay?" And talk to myself like in a nicer way, because that voice in my head is not nice to itself. And so
Right.
that is how you change it, is by saying no to it and reversing it.
Awesome. Well, Aneela, thanks for joining me tonight. I really appreciate it. And thank all of you for being here on our Wednesday night webinar that we do for every Wednesday night for NOCD. If you're looking for help for OCD or related conditions, check us out at NOCD.com. We would love to help out however we possibly can. For all of you, again, who have gone through some hellish things this week, we know there have been so many weather things. Our thoughts are with you. Stay safe. We hope to see you here again soon. Thank you, everybody, and make it a great week. And